Okay, so let's talk about this. Until last year, it was an unknown phenomenon. Now the coronavirus has spread around the world and has experts scrambling to keep up. For more on symptoms, exposure, and what bringing down the curve means, we have on the line Professor Anton Stoltz, Head of Infectious Diseases at the University of Pretoria. A very good evening to you, Professor. Thank you so much for speaking to us. So we've seen South Africa experience what is certainly a sharp spike from the figures that we had yesterday to the figures that we have today. What is your sense of our curve, our infection curve?
Okay, thank you for the opportunity to speak to you. So first of all, I think our curve is really disturbing. If we look at what is happening, what happened in Italy, we had to look at what happened all around the world. Our curve is actually even steeper than what we expected. Okay, so we could expect to have a big outbreak, and that is how we see it. But from the beginning, we thought that this will be the route it will be going.
And Professor Stoltz, we've been hearing from scientists across the world, and just in terms of the projections, some are even looking at the population size in line with how quickly the disease is spreading. But we've been hearing this term of flattening the curve. So please just explain it to our viewers what exactly it means, and if it's possible for us at this stage in our infection rate.
Okay, so when we say we want to flatten the curve, social distancing is perhaps the only way in which we'll be able to do this. The problem we have is that we are still not doing anything that is changing our behavior. So, I think what is needed is that we really start now to look into the fact that we should do much more. And get social distancing, stop the flows, stop the taxis perhaps for a while, and things like this. I know it's dramatic, but the point being that if we don't do it now, we will see a huge outbreak. So we are still in a phase where we can perhaps contain it to some extent, or just flatten the curve that everybody's talking about. But I do think we need to act fast.
In terms of our exponential growth model, do we compare with other countries who their infection numbers just pretty much blew up? Just in terms of infection generation, does it really mean that if one person is infected, we're probably going to see another 2 more, another 4 more, or 5 more that are infected?
Yeah. If I look at the figures, I think we are pretty much what we saw in South Korea in the beginning. We pretty much what we saw in Italy in the beginning, but we are quite early, so it is time that we act dramatically. So yes, I don't want to compare it to any country, but because we are not the same, and anything can happen. So, but I do think that we need to make sure that we handle this correctly, to make sure the infection is getting under control. But even if we act now, it will take 3 weeks before we will see the effect of this.
And I want us to explain, for you to explain to us why we're not the same. If we see the fact that, for instance, Zimbabwe has literally no cases at all, and all of a sudden it is the first in sub-Saharan Africa to have a death. Population density versus the spread of the disease. What are the super spreaders? Why does it matter why we differ as countries?
Okay, I think in the beginning, the lack that we had of cases, I can say that if you look at the airplanes in the air and we talk about drivers of disease, then we can talk about, the amount of people that is been transported from different parts of the country. You just have to see the amount of planes that is landing all over Europe and in America and in Asia. Compare that to Africa, South Africa, it's much less. I think that had a big time delay for us, which was a wonderful thing because we could start planning what happened. I do think what is happening now is with our population, people that is staying very close to each other, and we use, the transport we use. I think those things will accelerate the outbreak quite fast. So this is not new to me because this is what we expected.
So what can South Africa expect? One is trying to at least put themselves in President Cyril Ramaphosa's position. He's obviously receiving at least advice from medical teams, the scientists together. But what can we expect as a country? As I mentioned, I mean, we are sitting at a high number 402, which is completely different. Almost 50% increase in the number of, infections since yesterday.
Yeah, like I said, I don't think, we must read too much. It's still low figures, but it's pretty much what we expected that will happen. I think there's plenty more cases that we haven't tested positive. I think there's many more cases outside. So what I do think is going to happen is that soon we will see the outbreak in earnest. And it's about time.
How soon, Professor? How soon will we see it? And people who already have pre-existing conditions, are they more vulnerable?
Yeah. Of course. I mean, people have been talking about this for a long time. We don't know. I don't think there's enough data out there, and we will be generating this data from South Africa to look at the vulnerable populations that we have. So I think what we will do is that we will have a careful look at all our different diseases in this country, compare them to the rest of the world, and only then will we be able to compare us to other countries. I think it's too early now, but we can make some predictions perhaps, but it's still guessing. Okay. We'll have to see what happens.
Just a final question. We are participating in the WHO trial for a vaccine. That's a long way off. Can we, in the meantime, employ the, the medication, the treatments that countries like India are employing?
Okay, so we're not participating in the trial for the vaccine, but we are participating in some other trials from WHO. But the point is that I can think, and we talked about it this afternoon, we still think it's a long way off. The problem you have is that once you're infected, you do not build up a very good immune system to the virus. And what happens is that, I think it's a difficult organism to prepare a vaccine again.
All right,
so I do think we are a long way off.
Thank you so much for speaking to us, Professor Anton Stoltz. He is Head of Infectious Diseases at the University of Pretoria.